Hello, and welcome back to the American Heart Association's Red Chair series, sponsored by Rochester Regional Health. Today, we are talking about heart disease prevention with a specific focus on cholesterol management. I'm joined by Dr. Gaurav Sharma, general cardiologist with a specialization in prevention here with Rochester Regional Health. I want to start out first asking, what role does cholesterol play in our heart health?
So to some degree, cholesterol is important for normal body function, but we know that too much of it, depending on our genetics and other risk factors, can lead to cholesterol deposition, which is plaque forming in the arteries, which over time, if unchecked, can lead to things like heart attacks and strokes and sometimes even death related to heart disease.
And we hear a lot about different kinds of cholesterol. Can you tell me about the so-called good cholesterol and bad cholesterol?
So we think that the HDL, or the good cholesterol, is protective to some degree, depending on the person, and that may help to remove some of the cholesterol from the bloodstream and bring it back to the liver. And the bad cholesterol, like the LDL, and sometimes the breakdown products of the triglycerides, can lead to formation of cholesterol plaque. So that can lead to things like heart disease, heart attack, and stroke.
So how can patients manage those risk factors? How can they help manage their cholesterol?
Yeah, to some degree, our cholesterol is genetic in nature. This is something that we've inherited from our parents, and we'll respond differently to the types of foods that we eat and the amount of exercise that we have. But generally, following a healthier diet, meaning eating more fruits and vegetables, avoiding processed foods, focusing on more plants and animals, can help favorably, as this will probably lead to less saturated fat in our diet, which will lead to less LDL in most people. And then exercise will help to prevent things like diabetes and prediabetes and maintain a healthy body weight, which will help to lower your triglycerides, which are one of the bad cholesterol particles, and raise your HDL, which is the good cholesterol.
So those are all great things that we can do for ourselves, but what about socioeconomic factors? How do those impact our heart health?
Yeah, I think most people know generally how to eat properly and that they need to exercise, but may not have the time and the resources to shop healthy, perhaps, or even have the time in the day to exercise regularly. So that's one thing. For example, if people are struggling to make ends meet, they may not be able to buy fruits and vegetables, or they're working 1, 2, 3 jobs, they may not have the time in the day to actually go out and exercise. But also there's access to care. If they're so busy, they may not be able to go see their doctor, they may not have a ride to go see their doctor, they may not be able to make their appointments, and that can adversely affect our health as well.
What would be, in your opinion, the most important takeaway for someone watching this video?
I think what's important is that despite everything in this world and things that we cannot control, there's some things that we can control about ourselves. And so I think taking that extra step, literally, by taking an extra step every day to walk, using the stairs whenever we can, trying to park further from the building that we're going to, that will increase our health, promote our health, and we know that small steps matter a lot. Small incremental increases in exercise can lead to profound health benefits. Similarly with diet, none of us eat perfectly, but if we can add that extra vegetable a day, try to avoid that bag of chips or that cookie or candy bar, that's going to lead to overall better health outcomes overall.
I love what you said. Small steps can lead to big gains. That's great. Thank you so much. Be sure to join us for more from here at the Red Chair series.